Good morning and good afternoon, colleagues. My name is Panos Mumsis. I'm with the Humanitarian Reform Transformative Agenda. I would like to welcome you all to the webinar of today. Today's topic is going to be about the practical steps that each of us working in a field operation, the steps that we need to take in order to ensure and to stop sexual exploitation and abuse by humanitarian actors at the operations level. But before introducing the topic and getting into also introducing the speakers as well, I would like to start with some ground rules regarding this webinar. So first of all, I would like to ask you all to remain muted at all times throughout the webinar. That's really important given the fact there is a high number of us attending, that we're all able to hear each other. Secondly, on the top right-hand side of your screen, you will see the third button is the Q&A. I'd like to encourage you from the get-go of this webinar to send us questions. The questions you will send come to me, and I will be asking them during the second half of this webinar. During the first 30 minutes, I will ask each of the speakers a couple of questions to introduce the topic and hear their reflections and their analysis. And 30 minutes past the hour, I would be taking your questions and try to be, of course, as specific. The objective of this is to be able, hopefully, to answer to your queries and by the end of the webinar to have a clearer picture as to what are the practical steps in order to put a stop to any possible sexual exploitation and abuse by humanitarian workers in the operation where we are. I'd also like to point out the fact that there is a chat box on your screen. On the top right-hand side, there is a chat box. I'd like to encourage you at all times to feel free to share reflections in between yourselves. I'm encouraged to see that in this webinar we have colleagues from 55 countries. A lot of colleagues from North America and Latin America. I see 6 countries in Latin America. Middle East, Africa. I'm sure there's a lot of good practices, a lot of good examples that in the chat box you can also share in talking among ourselves. This is an interactive conference call, discussion, that really the wealth of knowledge between all of us is also crucial with this. I'd like also to let you know that this webinar is recorded and will be available on our internet page right after this webinar is over and a few hours later. So if any colleagues were not able to attend it, you will be able to point them to the recording and they can hear it back again. I also want to let you know that we will prepare a summary of the webinar discussion, a 2-pager. And most importantly, we really want to be able to capture the practical steps from this wisdom of the discussion of the speakers. So that will also be emailed to all of you with the seminar, with the webinar summary, and also the PowerPoint presentation that will follow during the webinar, so you're able also to look at it as we go through. I also want to point out that I hope you can all hear this webinar well. In case you have any sound problems, I want to point out on your screen there is a YouTube connection, the point item 3 in your screen. So if you click into that, it will take you to YouTube, and if you are in a deep field location, hopefully the sound quality will be a lot better. You'll be able to hear us well. Now, on the right-hand side, you will also see there is a polling that has opened. It's basically we have a few questions that we would like really to ask you. It's more really to help us understand who is online and who is listening to us as we speak. Now, I'd like to take us back to today's topic, the sexual exploitation and abuse. It's really a very sensitive issue. It really is one of the most basic failures, I would say, when it happens in terms of our accountability to those who we are there to support and work for and help. As the United Nations Secretary General has said, the trust that people put on us should never be broke by despicable acts of sexual exploitation and abuse. It is our responsibility to protect all those who we serve. Now, in today's webinar, basically we're going to focus very practically on the steps that every senior leader, every member of the humanitarian country team or humanitarian coordinator or a member of an NGO, a UN agency, an international organization needs to put in place in order to ensure that prevention of sexual exploitation and abuse is properly addressed. And of course, to make sure that we have a satisfactory protection and support to survivors of sexual exploitation and abuse wherever it takes place. I'd like now actually to introduce our speakers before we go into the questions, and I'm really delighted and honored to introduce the two distinguished speakers that we have with me. I'd like first to introduce Ambassador William Swing. Ambassador Swing, he's the Director General for the International Organization of Migration, and he's also the Interagency Standing Committee champion on the prevention of sexual exploitation and abuse. Ambassador Swing is joining this conversation. He's sitting with me here in Geneva. You're very welcome, Ambassador Swing. I would also like to introduce Mr. Mohammed Fall. Mr. Fall, he's joining from Central African Republic, from Bangui. He's the UNICEF representative at the Central African Republic, but he's also the focal point on the PSEA at the Humanitarian Country Team in Central African Republic. Mr. Fall, it's great to have you also joining us live. We have particularly decided to take the Central African Republic as one of the countries where we were very much looking to hearing to the proactive steps and actions the leadership in country, the ACT, the different agencies have taken place. So we will be hearing also from Bangui as well. So, Mr. Swing, I'd like to, if I may, start with the first question. And I would like to ask you, why is leadership at the field level, of course at all levels, but in particular at the field level by humanitarian coordinators, so important in terms of preventing and responding to sexual exploitation and abuse by humanitarian workers?
Thank you very much. Welcome to the webinar. No, I mean, it's pretty straightforward. It's at the field level where the problems occur. And it's there where the responsibility is the greatest, because it's there where our reputation is on the line every day in the manner in which we work with the beneficiaries and our partners there. I have been personally concerned for a long time about the issue. It came to me in a very personal way. A couple of missions I led, I became aware of it then, and have since then been trying to work within the system to ensure that all of us are aware of this and that we have in place a set of steps and measures that will guarantee as much as possible against the reoccurrence of this terrible action. It's basically, I think this thing came to the UN system's attention first in about 2003, 2004 in West Africa. It's the first recollection I have of it. He has continued throughout this and is not yet in any way under total control. The consequences are pretty straightforward. It's a collective failure on the part of the system to protect the very persons who've been entrusted to our care under our mandate. Obviously, it harms our beneficiaries who are the victims of SEA. Directly, it harms them, it harms their families. There's a systemic and organizational, reputational risk that's involved in this. We're ultimately then unable to fulfill our mandates, and we lose the support not only within our organization, but of those member states who are supporting our particular mission. So we need to guard our credibility at all costs. There are a number of challenges that we face. First of all, there is not yet sufficient, I say this guardedly, there is not yet sufficient senior leadership throughout the system who are committed to this proposition that sexual exploitation has to be avoided at all costs. And I'm sorry to say, and I think this is what we're working on today, that PSEA has not yet gained a clear place within the humanitarian architecture. This has resulted in a lot of ambiguity. It's resulted in ad hoc measures that in the end don't do the job. Now, I'm very pleased that we're going to have a session on this at the Humanitarian Coordinators Retreat at Montreux here in Switzerland. I look forward to going to that along with Jane Hall-Lute, who's also got now new responsibilities in this area. So I think we'll go there knowing that we've made some progress, but I think we'll also recognize that there is still a very long way to go if we're going to get this situation under control. I think clearly the problem has not gone away. We know this from instance even within the last 2 months in several countries. So perhaps at this point, let me just say that we've done a good deal already, and I'm happy to come into that maybe later, Panos, in the conversation. But let me leave it at that, simply to say status quo is unacceptable. We have to be proactive on this issue, not just a question of condemning it in public statements, which is important. More importantly, it's really all about changing, making real behavioral change, and about institutionalizing the prevention of sexual exploitation and abuse within the humanitarian community and the broader UN system.
Ambassador Swing, your personal experience and your leadership on this is really crucial. Indeed, you're very outspoken saying there's not sufficiency in your leadership. The problem is not going away. The status quo is unacceptable, and there has to be a behavioral change. And this leads me to the second question. So what do you see that really needs to happen, or what guidance exists at the field level to support our colleagues who I think everybody agrees is unacceptable? Really, we cannot continue with the current status quo, yet practically, what needs to happen and what guidance is there within the humanitarian family to make sure that everybody listening knows what exactly to do in order to make sure that this unacceptable behavior stops?
So thank you again. Let me back and say that there are some steps that have already been taken. We were able in 2011 to appoint a so-called champion within the UN system for PSEA. Actually, it's fallen to me to do this. And I think I must make a confessional here, as I did in the previous webinar. I said at the time to the members of the IASC, of which IOM as a non-UN member is only a standing invitee, I thanked them for selecting me, but I said I realized I was selected not because I succeeded, but because I failed. And in point of fact, in one of the 2 peacekeeping missions that I led in Africa, we had gross abuse in this area of sexual exploitation. And we almost lost one of at the time, the largest mission the UN had ever had in peacekeeping because of the misbehavior of all elements of the mission, not just the military, but the police and also the civilians. So I've known from that the damage that this can do to individuals and to the organization itself. So we managed in 2015 to get out an IASC statement on PSEA. It's very clear what it says. It says that it calls on us all to reinforce the responsibilities on PSEA for the humanitarian coordinator role to ensure that PSEA has a clear place within the humanitarian architecture system. So that's one of the steps that's been taken. But some of the practical measures are this has to be in our SES, in our terms of reference. It needs to be there at the top. When I went to the Philippines after the Haiyan typhoon, I saw what we were doing on the ground, and I said immediately in everybody's terms of reference for our emergency work there, the first item has to be on the lookout, be alert to possibilities of SEA. And I think that's a good rule for every emergency operation that we're involved in. There are a number of tools that are being developed, and I'll mention just very briefly those. we had 2 pilot projects in Ethiopia and the DRC to develop what we call community-based complaint mechanisms, CBCMs. These were very successful. We hope they can be replicated, and that from this, the lessons we learn can be communicated to the field to help you. From this has also come a guide that will soon be sent to the principals within the IASC for approval. Once it's approved, then it will be distributed broadly, circulated widely, and regularly brought up to date. The second new tool to help you is a global set of standard operating procedures on SEA allegation referrals, so that everyone knows what to do when they have an allegation, what to do with it. We were asked to lead a task team of agency experts to develop these SOPs, and they will soon be available to you. We're working with 15 agencies, 9 UN, 5 NGOs, and IOM itself to develop these procedures. And the effort is to fill a major gap in the area of PSEA. The aim is to develop a template that clarifies exactly how agencies can work together to promote the prevention of SEA. The third one is a common reporting platform called a CRP. The pilot demonstrated to us all that SEA prevention and response is going to require standardized data collection and intelligent incident tracing to monitor and evaluate the SEA trends. This will be, I should say, an online monitoring and evaluation tool to be used to log both the SEA complaints we receive and also to document PSEA awareness raising events that are in the offing, to monitor agency responses, including their progress in investigations and referrals for assistance, and to track feedback from the beneficiaries. I think for the moment, I'll stop there because there'll be questions, and we want to go on to other things. So let me leave it at that for the moment.
Thank you, Ambassador Swing. I think we're all looking forward to seeing the guidance coming out, which is a long overdue, but very much needed. Of course, the PSEA issue is not a new one. And indeed, having this operational procedures would really go a long way to be able to have at least some reference for colleagues in the field. And talking of colleagues in the field, I'd like to take us all to Central African Republic. I'd like to take a question to Mohammed Fall. Mohammed, the Central African Republic has been a lot in the news with cases of abuse, in particular by peacekeepers. Now, I'd like to ask you, what actions have you taken in your capacity as a focal point at the HCT, but also you're the UNICEF representative? What action have been taken in CAR in really to be able to address it? I also want to say that what is unique or makes it a little bit more complicated in CAR is the fact that it's an integrated mission, and there's a number of countries around the world where we see the integrated mission. So it's really to see what action you took within the humanitarian family, but also how this was linked within the broader approach. Ambassador Fall spoke about the reputational risk when this happens to all of us in countries. So Mohammed, what are your reflections?
Thank you very much, Panos. Allow me, first of all, to greet Ambassador Swing and say how pleased and honored I feel to be sharing this panel with him. To greet and thanks all the participants who registered for their interest in this important topic, but also for their interest in hearing the experience that is coming out of CAR. It is true, as you pointed out, Panos, we do have a situation which I could depict as one of the most alarming when it comes to sexual exploitation and abuse, mainly committed by the international forces. We have not only an overwhelming number or a number which is highest compared to other countries where you have peacekeeping mission or strong presence of the international community. But what is most shocking is that a good number of the cases that we know or that we are having or we are managing involve also children, sometimes girls, and sometimes also boys. But at the same time, I wanted to say that we are proud to mention that the initiative that has been taken to change the posture of the international community across the board, whether it is the humanitarian community, the UN country team, or the peacekeeping mission, are extremely important. They have been serving in many respects as a blueprint of the work that the international community is collectively doing today to address the issue of sexual exploitation and abuse. I think our reaction and response, I can maybe summarize it into twofold. One is the concrete step we have taken to stop sexual exploitation and abuse. The other one is the response and the protection and support that we provide to the victims. I would say that in the level of the practical step to stop and prevent SEA, I can summarize it into maybe fourfold. One of them will be leadership, strengthen in this regard. The second is strengthen mechanism of coordination, work out also of guidance material and some concrete action that need to be taken to make sure that we fully implement the SOP and the zero tolerance policy. Maybe we can move to the slide on the practical step related to leadership. I think it is extremely important that we define role and line of accountability at the level of humanitarian coordinators and at the level of the entire humanitarian country team. It is important also that SCA and its prevention become a part of the discussion and meetings that the humanitarian country teams held on a very regular basis. SCA also should be part and parcel of annual plan of individual agencies, but also of annual plan of the humanitarian country team. Each agency here in CAR has been tasked and has fulfilled this task, an individual who is a focal point on the PSEA task force of the humanitarian country team. The coordination mechanism also is done through the focal point, but the coordination mechanism is done also through the way we bring together the different entity of the international community, both the humanitarian country team, but at the same time, the UN country team, but most importantly also, the leadership of the mission to have a mechanism which is set at a leadership level, but to have a mechanism which is set also at a technical level, which work mostly on prevention. Maybe let's move to the next slide. In terms of material, guidance material, I can refer briefly maybe to three key elements that we are using here in CAR. One is the code of conduct, which has been widely signed by a very overwhelming number of part of the humanitarian community, UN, international NGO, but at the same time, national NGO. We have also SOP of addressing and preventing SCA, which include also mapping the possibility of offering assistance, mapping the possibility of having a system of alert, mapping also a possibility of getting information and sharing it on a timely fashion. We do also have among this material an information protocol sharing, which we share at the wider level of the UN country system. The action, I will go maybe briefly to keep it, not to take much longer time. It will be to protect and support survivors. I think I will come to it later on. The signing of the code of conduct by the humanitarian and the peacekeeping, as I mentioned, at an individual level. Make sure also that resources are available for the implementation and monitoring of the ICT PSEA action plan. Because as we realize is that SCA, both the prevention, the alert, and the response require a huge amount of resources. Major attention and managing also the major focus is a component or is a part in which we are also working. Maybe, Panos, I will leave it there until we get more questions for me to elaborate further.
Thank you, Mohammed, and really thank you for putting the steps in the 4 categories. I heard you talk about the leadership, the importance of the top leadership of every organization, every one of us, whether we work with the United Nations or with an NGO, with an international organization, the need for coordination, the guidance material, this having the code of conduct, but also the actions. This was very useful to follow, and I think this will be among the material that we will also share with all participants. If I can take us back 1 minute, Mohammed, you also started by saying also the fact that you've also worked as a humanitarian family with the peacekeeping mission, and I can see that there is also a slide you have prepared, which if you can tell us 2 words about how this interaction, because it really, there is a link in between what we do as humanitarians, but also to make sure that the broader community, including peacekeepers, also have the mechanism in place. Mohammed, over to you.
Thanks, Panos. I mentioned earlier also how coordination is being strengthened across the board and not being limited only in the humanitarian or the UN country team. And I think, as you see also, most of, or the highest number of cases we have here in CAR are mostly involving peacekeepers or international forces in uniform. I think this requires that whatever we do also take strongly into account the collaboration and the cooperation that we establish with the UN country team. Let me highlight also that a strong leadership has been really shown through the UN system. I think the 6-7 past months have measured such a bold measure in terms of prevention that I have never seen anywhere else. Like, for example, the force commander, the SRSG, all the leadership of the mission going together to tour in each of the troop or contingent posted within the mission and reinforce the zero tolerance policy and raise awareness, hold the people accountable of what is happening. We have seen also in terms of coordination, a huge undertaking in terms of bringing together now within the PSEA task force of the mission, the key UN agencies that are having also responsibility on SCA or PSEA, which are UNICEF, UNFPA, and UNHCR, sitting and being full member of the PSEA task force of the mission. The same task force is replicated also at subnational level, and as of today, almost in all the major area where you have the operation deploys and where you have UN agencies set up, you have also the same mechanism under the leadership of the head of office of the mission and with the participation of the leadership of each of our individual organizations at subnational level. You do have also a kind of information and communication that is being spread in terms of raising awareness among all the troops, organizing training for all the troops once they land in CAR. Doing also a kind of mass communication using poster, using picture in any setting or compound where you have potential or where you have risk. You have also a lot of steps that are taken to patrol all the sensitive area or area where you have a high risk to make sure that any misconduct is identified on time and is prevented on time. You have also a huge awareness campaign which is being undertaken by not only the mission, but in partnership with the other UN agencies, trying also to raise awareness among the community, because let's not forget that victims, survivors are coming from the community. So working only among the potential perpetrator wouldn't be enough if it is not complemented by a work we are doing in awareness raising, prevention, information sensitization within the communities. I'm telling them the risks that are there or telling them the mechanism of complaint that exists. These are just a few examples, maybe not to keep it too long, that I wanted to share, which are part of the joint work that we are doing within the context of the peacekeeping mission.
Thank you. Thanks, Mohammed. It's important to have a comprehensive picture. We'll come back to you in a minute. I have to say we're receiving lots of questions from colleagues. I also want to invite others who have not done so to please go ahead and send your question. I'll do my very best to take as many as we can in the remaining time. Ambassador Swing, one of the questions that we have received is this question of how do we address questions of the prevention of sexual exploitation and abuse in conservative communities. Often we are told in the country that there is cultural barriers. You cannot simply raise this question. At the same time, we're trying to ensure to a minimum principle. What's your advice to working in let's say, culturally sensitive communities around the world?
Well, I'm very glad the question has been raised, because we do have to be sensitive and we do have to adapt according to the community in which we are. I think there are some practical ways. I always believe in dialogue, transparency, and engaging the local community. I think that's the way to ensure, to the extent possible, misunderstandings, and the way to bring them on board with a program that is of vital importance to the UN system, and I believe to their communities also. We have to help them to try to find a personal interest in supporting the PSE efforts that we're making. So we engage the communities, we engage the community structures in the discussion that is critical to ensure that they understand that we as humanitarian workers, we have a code of conduct, we have some standard operating procedures, we have principles, and we have certain behaviors under those principles that are absolutely prohibited. We should also help them to understand that it is in their interest to bring instances to our attention through supporting and helping set up a community-based complaints mechanism. Because we noticed, for example, the two sessions that we held in Ethiopia and the DRC, I don't know how many complaints they received before, but we know that through those two interagency complaint mechanisms, we received a total of 281 complaints, 200 in the DRC, 81 in Ethiopia, of which 43 were SEA allegations against humanitarian staff, 37 in the DRC, and 6 in Ethiopia. So the system does work, and the fact that you suddenly get all those numbers doesn't mean there weren't problems before, but there was no acceptable mechanism through which to make the allegations and the violations known. So I think that was what I would say at this point, the engagement of however conservative the community is, to engage them in the process themselves.
So be direct, be open, and really be able to tackle it directly. I'm going to take us back to Bangui, back to Mohammed. And Mohammed, one of the callers has pointed to your presentation earlier on, where you said this four-step plan, and under actions you highlighted the protecting and supporting survivors and ensuring awareness among the affected people. So one of the callers says, can you tell us a little bit more specifically, in Central African Republic, what have you done in order to support the survivors of sexual exploitation and abuse, and also to increase the awareness within the community? Mohammed, over to you.
Thanks, Panos. Thanks for also the question, because as I say earlier, this is one of the important part also of our endeavor in addressing SEA here in CAR. The way I can put it is also the response is not one-fold, but the response is a wide range of initiative and action taken given the individual situation or the situation of each survivor we have to assist. The first, and which is almost something which is coming always, and one of the first part of our assistance is the medical support. Because as we know, most of the time, the sexual exploitation and the sexual abuse, its immediate and first consequences is on the physical part. We proceed using a network of partners here to what we call a medical screening. And in most of the cases, the medical screening leads to some other step in terms of medical assistance if an infection is detected, or if, for example, there is a disease that is detected, we set a protocol that allow the victims and the survivor to go through all the needed steps to recover from what has been identified through the medical screening. The other component is psychosocial effort or psychosocial support, because as we know, as I say, yes, you do have immediate manifestation, immediate impact, which is physical, which could be linked to the health. But I think the most devastating consequence of exploitation and abuse, mainly when it regards an underage person, it is the psychosocial and the mental aspect of it. And we have a huge component in our response which is devoted to it, through which we provide a counseling session. We identify which kind of trauma or which kind of distress the victims are going through. And based on that, we use modules or we use staff that has been trained by specialized psychologists to assist the victim to recover and have the wound that they have at a mental level healed. The other aspect which I wanted to talk about a bit is what we call reintegration, because as you know, in most cases, when this SEA happen, it leaves also some social consequences which are sometimes tragic for the victims. One of them would be that the community rejected them. One of them would be that they are stigmatized. One of them could be that they can lose the activities they had. If it is a child, it could be education. If it is an adult, it could be livelihood activities. There is a wide range of support that is required or needed for the victims or the survivor to be in a position to gain back or to return to a kind of normal life. We have also a support which is provided through the interviewing process, because for the legal assistance in most cases, and now with the commitment and the drive that has been shown throughout the UN, starting from the Secretary General, we have seen that member states are reacting in much faster way, in much stronger way, by sending national investigators to substantiate the case of allegation their element or their troops are involved in. And this process also required a support to and an assistance to the victim, because having a child or having a woman who in most cases come from very vulnerable background, from very poor family, facing an investigator, answering to question, requires some time that they get assistance. It requires also that in the SOP and the guidance material that we were talking about, that we work on a protocol of interview which respects the standards for interviewing a child or standard for interviewing a victim. That's also another area of our support. Maybe I will just say two words to conclude this part, which will be the relocation, because more and more we are seeing that in many cases, stigmatization or overexposure to media could lead to a certain risk, because the victims or the survivor can be further marginalized, and sometimes also reintegration can be blocked because of number of difficulties, or the victims can also find themselves even sometimes to be witness and witness at risk. And sometimes what the kind of activity or response we need is to relocate them to area where we are sure that they will not be subject to pressure, subject to bribery, or subject to some other threat. I would say also that in the legal front also we are seeing more and more that sometimes this exploitation or this abuse can result into pregnancy, it can result into child delivery, and we are seeing from the side of the victim also a demand or a recognition paternity demand for which they need assistance, and for which some partner we are working with also work in this kind of assistance. Just to say that it's a wide range of intervention that we need to put a victim or a survivor back on its feet, or in a process of healing the wound or recovering from what they have gone through. Maybe I will keep it there until we have all the questions. Back to you, Panos.
Thank you, Mohammed. Thank you for really giving this comprehensive reply on, of course, everything that we can do to support survivors. We all know that the scar that goes through a little boy, a little girl, a man or a woman most probably is one that stays with them for the rest of their life, and often really has a huge impact on the rest of their life. But at least everything we can do in the meantime to support them, we must absolutely follow. I'm going to take us now back to Geneva, and Ambassador, one of the listeners has responded to what you said earlier on about the guidelines that are coming out, and the colleague says it's great to have the guidelines, but really what I would like to know is who is responsible in terms of the legal prosecution that needs to take place. Really, are we, what would the agencies, what would the organizations, what would the system do to make sure that we also have a bit of a strong stick approach, so that really people do not get away with impunity when such horrible acts take place?
No, that's a very key question, and I think thank you for that. We have pretty clear guidelines from the December 15 statement of the IASC that we are committed to criminal prosecution, and in that regard to develop best practices on investigations and on whom to refer cases for national authorities for prosecution. Unfortunately, these are not yet done. We hope to move forward on this in the course of the months ahead. This involves all of the IASC agencies and some of the standby invitees like IOM. I think you raise other questions too. We are not going to be credible unless we have some kind of a feedback system, so that the victim, those been involved all along the way in the initial investigations and so on, and the community at some point come to know what exactly happened to the perpetrator. Were they actually brought to trial? Were they ejected from the UN system? Have they resurfaced in some other UN agency or an NGO? All of these things will either determine or detract from our credibility on the line. Now, so I agree entirely. It's one thing to write guidelines and procedures and codes of conduct, but what will really count is whether we can be seen credibly to be following up to the end to a prosecution.
Thank you, Ambassador. I'm going to take us back to Bangui, and Mohammed, one of our listeners says, it would be good to hear how we can better involve the local authorities when such incidents, in prevention, in awareness, at all steps of it. So if you can highlight from the CAR perspective, how did you go in involving the local authorities on this sensitive issue?
Thank you, Panos, and thanks also for the question. Yeah, you are right that the local authorities have a key role to play, because as I think I have highlighted in the previous webinar, what we are seeing, though it's awful, it is involving the international forces who were supposed to provide protection to these victims. But we do believe also that it is very difficult to delink what we are seeing involving the international forces with the overall context and the general context of violation or violence against children, violence against women. And I think this issue can't be addressed isolated, just looking at the tip of what we call the tip of the iceberg, which is the most visible because they involve international forces. I think a huge undertaking is needed to address this issue, to look at underlying causes, to look at root causes of this situation within the cultural or within the context in which we are operating. And sometimes we know that it involves a lot of issues that need the international or the national stakeholders or the national counterpart to be part of this process of addressing the issue. You can't address SEA or violence against children or against women in any given context without looking at it from a kind of holistic programmatic perspective, to be able to address the judiciary system, which we know is now challenged by a lot of difficulties and almost inexistent in the context of CAR. And unless you have a kind of judicial system that can bring perpetrator to face justice, that can stand against impunity, that can really bring the legal response to the victims, I mean, you still have a gap in the response. And this is an endeavor that the UN country team, mainly not only the humanitarian, but the other UN agencies working on development, working on a longer term perspective, have as a responsibility, and that they are fulfilling together with the national authorities. The second aspect also, as we say, it is taking place in a context where you have to address also the situation from the perspective of the community. Because as I was saying, it's not an issue of only preventing it from the potential or the possible perpetrator. It's also preventing it from the potential or the possible victim. Building awareness, sensitizing, but at the same time having communication for development, having social mobilization programs that can help to address the social norm, which are part of the root causes of this phenomenon, which is linked to violence in general, is also part of the endeavor that I think is needed for this issue to be addressed on the long run and for this issue to be addressed together with the national stakeholders. Yes, of course, there are also issues that are more sensitive, because if it involves today national or international forces, we all know that so far, maybe none of the UN governance body, neither the Security Council nor the General Assembly, would allow that a separate or a foreign forces go and do investigation within their own army. Maybe those are issues that need to be worked out at a global level or at a collective level to see, because when national forces or investigators are conducting this kind of investigation, yes, there is a courtesy rule that they will inform the national authority who are the host government of those peace or keeping mission of those international forces. But we don't, today, in the overall architecture of the UN resolution mechanism of establishment of a peacekeeping mission, there is no room for the national authority to be part of that investigation. But I think that if, for example, we can work around a certain number of propositions that I'm seeing the UN leadership putting today on the table, and some of them could be also part of the solution that can help to build national capacity to be able to better response. But the way I see it in summary is that we need to place the prevention and the response to SEA within the context of building national capacity, and national capacity both at government and at community level. And last maybe what I would say is that in terms of response, we are also delighted to see that a lot of national NGOs are partnering with us, and they are gaining a huge wealth of experience in addressing all the aspects that I have mentioned, whether it is psychosocial support, medical support, relocation, legal assistance. And in most of the cases that we are managing today in CAR, our partners are coming or are of national background. We do have international partners participating in the response, but local associations like Women's Lawyers Association or some other associations are playing a very active role. And we believe that this capacity that they are gaining will stay in the country, and in the long run will help to address, as I say, the general issue of women's rights, of child rights, beyond the issue of violence or sexual violence. Over to you, Panos.
Thank you, Mohammed. I'd like to remind colleagues that we have about 10 minutes or less left of this webinar. I'm taking your questions as they come in. I would also like to ask the speakers to be as brief as they can, so we take more questions as we go. And Ambassador Swing, I would like to take the next question to you. One of our speakers has sent a message saying, we welcome Ambassador Swing's very much a blunt statement saying that there isn't sufficiency in your leadership on PSEA, that the problem is not going to go away, and we do need to see a behavioral change. Yet, let me tell you, I'm working in a major operation where the handling of PSEA is so erratic. We seem to be strong when we have big cases, like we've seen in Central African Republic. We very much welcome what we hear coming from Bangui. But what is it that makes us really as a system to be reluctant to take action? And more specifically, to take action on recriminations when something happens, whether it is an agency that the staff member goes and it gets hired by another agency, or whether it's a peacekeeper from a peacekeeping contributing countries. And let me tell you, the caller says that member states, when the peacekeeper goes back, nothing happens. There isn't really any follow-up that takes place, which really makes us all, UN, peacekeeping, NGOs, member states, seeing that we take zero account to make sure that really proper action is taken place. So Ambassador Swing really is about this, the leadership within the agency, but also within the system to ensure that accountability to make sure that this behavior change takes place and really we don't see any more this unacceptable behavior.
Well, thank you very much for a very insightful commentary and a number of key questions that are raised there. I mean, clearly, when we have all of our troops that we have, I had 54 countries providing troops when I was in the Congo. Clearly, we have limited control over them or the ability to pursue prosecution once they return home. We try. We've tried many times. It doesn't always work. I think we probably need some better understandings before they leave. If I look ahead and see sort of what's still lacking in the system, this is one of them. We need to have some very clear pre-departure orientation and training of all troops and police and others coming in from the outside who are not actually part of the system as such, but on loan for a temporary period. They need to know very clearly what the rules are and basically be able to sign up to the program. If they can't sign up to it, then they should probably be asked to stay home so that they arrive already with a clear idea of the UN's commitment on the question of SEA, and that we will be extremely forceful in ejecting them. At some point, one might also have to eject the commanding officer. Depends on the severity of it. But I do think that the message has to be made clear to them. And I think most of the peacekeeping contributors would be willing to sign up to some tougher measures, some more consequential measures. The other areas I think we could improve in is we need a much clearer and a much more consequential policy on victims' compensation. I'm not necessarily talking about money. My colleague Mohammed Fall mentioned already things like psychosocial support, perhaps finding a way to get to get back on their feet, if you will, although they can never be made totally whole after such a violation. But a more serious system on victims' compensation. I think we need a very foolproof system, and surely in this day of computers and instant information, we can come up with a foolproof system to ensure that any SEA violator who has been found to be such and has been ejected from an agency does not reappear and resurface in another UN agency or hopefully in the NGO world. I think we need a wide sharing of information to make sure that the violator remains outside of any system that has to do with beneficiaries who've given us their trust and who need our help. I don't think yet that we have an adequate feedback system. This, I think, again, Mohammed, you raised feedback system on what happens to individuals who are violators. What is the end of the story? Does it ever get back to the person violated and to the community involved? That gives us more credibility. I hope we have adequate whistleblower protection. We haven't addressed that one. Certainly more active senior leadership we talked about. And I will make one slight little personal view on, I was opposed at the time it happened, and I think it still was a mistake, to subsume PSEA under the AAP. I'm all supportive of the AAP, but I felt the minute it goes under that, it becomes a secondary issue and it should stand on its own. That's all of it. Thank you.
Thank you, Ambassador. As you were speaking, I was monitoring, and actually a colleague listening sent a message right away and say, I would like to propose that we establish in our system, United Nations, NGOs, broader family, a system of a blacklist where really names of people who are abusers are, and any hiring takes place, really would have to vet it against the system to make sure that it's clear to everybody that any abusers are known and will not be hired by anybody else. So what do you think on that proposal?
What I think is required. Otherwise, we're going to have people coming back a second time.
Thank you. Just to repeat, you said you think it's absolutely right. We lost it.
Exactly in the right direction. What I also was trying to propose. You said it more forcefully.
Thank you. Thank you very much. Colleagues, I'd like to point out to everybody that we have a closing polling that has opened. I'd like to encourage you all in the next few minutes, and also the closing polling will remain open for 15 minutes after the webinar is closed. We would appreciate if you take a minute to give us your feedback, your impression on the preparation for this webinar, and also give recommendations for other webinars. I want to repeat, I see a number of colleagues have joined, that this webinar is recorded and will be placed back, will be available for all of us, will be available on the internet. So Mohammed, I'd like to take the last question back to you. And one of the callers says, surely, shouldn't it be in a country like Central African Republic that any colleague, before even arriving or even spend there, they should really have signed the code of conduct? Part of the introduction should be really to understand the parameters, the judicial responsibility, the accountability, and this should be for all of us, humanitarian, peacekeepers, and really to standardize it throughout the world. What's your reflection on preparing colleagues coming, whether it's from police, military, or humanitarian on PSEA?
Yeah, I think it's a great idea. And I think now we are in a kind of momentum, I could say, within the international community. Because I have seen few times the UN, not the international community in general, because when I talk about UN, it's the UN leadership, it's the secretariat, but it's also the member states, have this kind of commitment, this kind of drive on preventing and responding to SEA. Now, in such a context, I think we can have in the conversation number of measures that can help or to further strengthen the zero tolerance policy. And as I think before even the speaker, raised, this question was raised, I think the Ambassador Swing spoke at length at the need of investing massively on awareness raising and conduct screening in a pre-deployment stage. And I had mentioned also the joint work that is being done between the mission and the UN agencies and the other humanitarian communities here in terms of training and messaging the troops upon their landing in CAR. I think also background check or whatever measure that can reinforce the screening process of the people, whether they are on uniform or civilian, who are deployed in a context which is like the one of CAR, and that can help to enforce the zero tolerance policy, could be only welcome. But of course, everyone will need also to require to work carefully around each proposition put on the table to see its practicability, to see the legal implication that it will have, to see all the implications. But I think any measure for me that comes across the system and the humanitarian community and can help not only to reduce but to stop PSEA would be enough. Because as I have been always saying, what is at stake to me is today things that are critical for mankind history. We all know the role of peacekeeping into maintaining peace, maintaining stability, and CAR is a good example. This country was almost disappearing from the map 3 years ago. The international forces has contributed significantly to pull back this country together and have a successful transition which have ended peacefully. But today, if we continue recording rising number of SCA, what is at stake for me is the image It's even the doctrine of peacekeeping. That's what is being questioned. And as Ambassador Swing was saying, if the very people who are supposed to protect civilians or vulnerable people are returning and exploiting them or abusing them, that is creating an issue which, at the long run, can put even into question international assistance or peacekeeping doctrine. Maybe allow me, Panos, also to raise just one last word about resources also, because I think this advocacy about awareness raising, about measure to be taken is important, but it's important also that we require and we look at the issue related to resources, because all the different steps of response that I have spelled out earlier, each one of them will be almost a several time intervention. None of them is a one-time intervention. It requires also a lot of resources. And one recent experience we have seen here in CAR, and here I'm talking on behalf of UNICEF, is that when we see organization mobilize from headquarters through regional office to country office, when we see organization mobilizing its resources, I think our executive director was saying recently that just to support the country office in CAR, we have mobilized 1.8 million, which represents almost 10% of our set-aside funding, just to make us able to respond to this case. This makes a huge difference. And I just wanted this word to be spread in the leadership that are listening to us, or those who might maybe benefit from this webinar, so that we don't forget or we don't sideline the question of the resources, but the scale of the response, its complexity require also not only policy or administrative measure, but it requires also that we set mechanisms that will help to bring assistance to victims. And I think we should also welcome the idea that the UN has come out with, which is to set up a trust fund for victims. I think that's a great idea which is being worked out, and we are looking forward to this trust fund. And we believe that that's the minimum, as the ambassador was saying, we owe to someone who is victim or survivor of SCA. This could be maybe my last word, and say thank you to everyone for the interest shown in this important topic and in the experience we are developing and we are working on here in CAR. Back to you, Panos.
Thank you, Mohammed. You raised some really very important points, the practicality of the step, the financial resources that make it all happen. I'm afraid we're running out of time, but I really want to give the last word to Ambassador Swing. And here, Ambassador, your words of wisdom and advice to everybody listening, given your long career, your experience. But I also have to say, sitting next to Ambassador here in Geneva, I feel a strong compassion and really fire coming up on driving the issue and bringing a change for all of us. So, Ambassador, your thoughts.
One quick thought and then a brief announcement of an activity coming up. I think we need to look upon the media as a friend rather than as an adversary in this whole battle against SCA. I think it's very important to be upfront with them early on. Don't let them discover something. Let them know, to the extent that you can, without violating privacy matters, that when you have a problem and how you're dealing with it, that's the way you build credibility. The second point is just an unpaid advertisement. At the World Humanitarian Summit on 23-24 May, there will be a side event on preventing sexual exploitation and abuse. There will be a panel, ECHO, Canada, the United States, Interaction, OHCHR, and IOM. And so I hope that that will draw further attention at the senior level to the issue of PSEA. Thank you.
Thank you. Colleagues, I'm afraid this brings to an end this webinar. We do hope you found it useful. We hope you're going away with some practical steps, tips on terms of how to take forward all the necessary action to stop sexual exploitation and abuse and ensure there is prevention and support at all levels. I really want to welcome wholeheartedly Ambassador William Swing, Director General for the International Organization for Migration, and also the IASC champion on PSEA. I also want to welcome Mohammed Fall, who is the UNICEF representative at the Central African Republic, and he also is the humanitarian country team focal point on PSEA. I want to thank all of you who have joined this conversation from all over the world. We will be sharing a summary. We will be sharing the conclusion, if you want, of the steps based from a field-up experience, and we're looking also forward to seeing the guidelines coming out. I tried to take as many of your questions and cover various aspects of this very sensitive issue. I hope the conversation further helped to enlighten and further advance what needs to be done practically at the field level. So really, from all of us, wish you a good day, and thanks again all for joining this conversation. This brings an end to this webinar.